What is happening? Oh, hi there, folks. Sorry about that. Hi, I am Sandy Roberts, your Education Program Manager and SciFri Book Club Captain, and welcome to a Science Friday live stream. Thank you so much for being here tonight or today. I'm very, very thankful. I am joining you from Northwest New Jersey, and I'd love to know where you're joining us from. So take a moment and add where you're from to our chat. I can see already that some folks are sharing where they're from in that chat. If you're signed into your YouTube account, you can join us. That chat should be to the right side of the video or below. So let us know where you're watching from today. I am always very, very curious. I see Finger Lakes, St. Augustine, Florida, Tennessee, Virginia, California. Welcome, everyone. If you don't know us, I like to say that Science Friday is your one-stop shop for all things science news. We're very well known for our weekly science radio show, broadcast every week on, you guessed it, Fridays from 2 to 4 Eastern. You can also listen to us every day on our podcast. So you can find that wherever you get your favorite podcasts, or you can check out everything that we offer at sciencefriday.com. If you click on the listen banner on top right after this live stream, you can listen to the live show. But of course, we're so much more. We have all kinds of articles, educational activities, and community experiences, just like this one, for everyone that loves science. So visit that website. But today, we are here to talk about this month's book club pick, The Kissing Bug by Daisy Hernández. The book explores who the United States takes care of and who it leaves behind. She investigates Chagas disease, a deadly illness that's more common in the US than Zika virus, but most Americans have never heard of it. Her aunt died of Chagas, and Daisy takes a journey across the country to understand how this disease could be so widespread, but so hidden. What she uncovers is a story about poverty, racism, and healthcare inequity that will change how you think about infectious disease in America. We'll dig into all of that very, very soon, and I look forward to a really fantastic discussion. Don't forget that you can keep this conversation going for an entire month, all through February, after the live stream in our SciFri Book Club online community space in Mighty Networks. And you can join us in the link that will be dropped into the chat. Before we get started, a couple of quick reminders. Science Friday is committed to providing a welcoming and harassment-free environment for members of all ethnicities, ages, genders, and gender identities, sexual orientations, physical abilities, national origins, beliefs, and any other dimension of beautiful diversity. We've created a code of conduct to help us create a safe and positive community experience for all, and you can read that in its entirety on our community space that I just mentioned. Because we believe that providing clear expectations is a necessary part of building a respectful community, here are the basics for today. Be supportive and respectful when speaking with one another or asking questions in the chat. Share generously and listen closely. You can add your thoughts or ideas throughout the conversation in the chat, even if they aren't strictly questions for the guest. We love to know what you're thinking. We are going to ask that you do your best to stay on topic, however. We're here to discuss this month's book club pick and related topics. And we reserve the right to ban anyone who engages in demeaning, discriminatory, or harassing behavior today. This is not 3 strikes, you're out. You're out immediately. Thanks for sticking with me. With that, we're going to welcome our special guest for today's live stream. So please join me by posting your emoji of choice in the chat to welcome Daisy Hernández. She is the author of The Kissing Bug, a true story of a family, an insect, and a nation's neglect of a deadly disease, which won the Penn St. Jean Stein Book Award and was selected as an inaugural title for the National Book Foundation's Science and Literature Program. She has spoken about the subject of her book, Neglected Disease and Racial Disparities in Healthcare, on MSNBC, and also with the Carter Center and the Pan American Health Organization. Hernández is also the author of the forthcoming book, Citizenship, Notes on an American Myth, and her memoir, A Cup of Water Under My Bed, which won the IPPY Award for Best Coming of Age Memoir and the Lambda Literary Dr. Betty Berzon Emerging Writer Award. Sorry. As a journalist, she has reported for National Geographic, The Atlantic, The New York Times, and Slate, and her writing has been aired on NPR's All Things Considered. Her magazine feature on transgender issues in communities of color was nominated for a GLAAD Media Award. We are so excited to have Daisy here today, and I want to thank her so much for being here. So let's meet our special guest. Hi, Daisy, welcome.
Hi, everyone. It's so great to be here with you. Thanks, Sandy.
As a reminder to our audience, we want your questions. So make sure at any time during this event that you put those questions or comments for our guest into the chat, and we'll try to get to as many of them as we can today. But before we get rolling, Daisy has a reading for you from, well, honestly, my very favorite chapter in the Kissing Bug, because it's the one that really gets you to just kind of stop and take stock of some of the really big issues that Daisy talks about in this book. So with that, Daisy, the floor is yours.
Thank you. And thank you so much for having me here. And thanks for joining me from all parts of the country. It's lovely to see where everyone is. And I'm in Chicago at the moment, just outside Chicago, actually. This is from page 228. In Tracy Kidder's biography of the famed physician Paul Farmer, Mountains Beyond Mountains, the doctor points out that there exists a great epi divide. People on one side of the epidemiological divide, Dr. Farmer argues, will die of diseases related to old age, while those on the other side will die much younger because medicine for treatable diseases is too expensive or the village does not have enough food. Or, I would add, because laws put restrictions on who qualifies for Medicaid or who learns about safe sex. Or because prenatal screening tests do not include the kissing bug disease. The phrase the great epi divide makes me think of old paper maps and signs about who is allowed to enter and who has to stay out. It is a phrase that points to an American reality. Some people are taken care of and others are not. A choice is made. The great epi divide sounds more accurate to me than the more ubiquitous disparities in healthcare, which suggests that a terrible thing has happened, but without active participation on anyone's part. Disparities arise, inequalities exist. These words trouble, but at the same time offer reprieve. No one is implicated. The same is true of the word poverty, that knife of an abstraction. A phrase like diseases of poverty obscures the degree to which we have made choices about funding for public health. The Great Epi Divide, on the other hand, says what we have done in the United States to contain infectious diseases to a second America. We have placed physicians in the position where they have to fight to get their uninsured patients with the kissing bug disease standard treatment for heart failure. We have passed laws so that a mother of 2 young children like Janet cannot get anti-parasitic medication because of her citizenship status or her job situation. We have failed to educate obstetricians and gynecologists about parasitic disease from Latin America, even as more physicians in the United States find themselves caring for expectant moms from this part of the Americas. None of this is to suggest that we are bad people. When it comes to infectious diseases, many of us are afraid. We do not want to get sick, and we do not want our children or elders to be in any danger either. If that means granting priority to our health over that of others, we do it. We accept the epidemiological divide with the hope that it will keep us safe. And the tyranny of the great epi divide is that, for the most part, it does shield us from illness. We work remotely and order groceries online to avoid COVID-19. We drink tap water freely without a thought of cholera. When dengue and Zika strike, we cancel trips to Key West and Puerto Rico. Or we travel to Haiti and Brazil and South Florida armed with bug repellent and a rage that is historical because our families live in poor communities there, and the epi divide is one we have been crossing all our lives. One morning, I clicked on a New York Times story and learned about what I came to call the epi elite. Families in the United States who can pay between $40,000 and $80,000 a year to have a team of well-connected doctors on call. One of the epi elites is John Battelle, the co-founder of Wired magazine. I feel badly that I have the means to jump the line, he told the paper about his concierge doctor getting a top orthopedic to see his son for a broken bone. But when you have kids, you jump the line. You jump the epi divide. I could not argue with Battelle. If I had children and an extra 80 grand a year, I might do the same. I wish I could say that I would place the money toward prevention and treatment programs for neglected diseases, but I cannot say it with complete confidence. The epi divide thrives on fear and greed. The irony is that in certain ways, the epi divide does not actually keep us safe. If we live in a region of the country where many people do not have health insurance, we won't be able to get the care we need even if we have coverage. Hospitals close down, doctors move to towns where they can earn higher salaries. We can find ourselves with health insurance and several college degrees and dragged to the other side of the great epi divide. One study from the pre-Obamacare days uncovered that a woman with health insurance did not get her annual mammogram when she lived in a largely uninsured community, in part perhaps because the low demand for the screening made it less accessible. Another study revealed that a pregnant woman has prenatal care services available to her. She has more prenatal care services available to her if she lives in a state where the legislature and the governor have expanded Medicaid coverage. More money for healthcare services brings more doctors, medical programs, and hospitals to a region. What I appreciated about the image of the Great Epi Divide is that it's not a solid line on a map. It can change according to whom we elect to state legislators, whom we put in the White House and on our city councils, and what demands we make of them. It can change if we want it to.
Yeah. I think especially in the moment that we're all living in, I know I'm thinking a lot about those in my community that don't have access that I do. And that idea of jumping the line, especially when you start having kids, or in my case, I have an aging parent. Yeah, it raises a lot of interesting questions, I think. Suzanne had a great question. I'm going to go ahead and share it right away because it relates to what you're talking about. Are you aware of any organizations that broadly focus on breaking down that epi divide wall? There are probably organizations for individual diseases, but she's wondering if there is a broader effort out there.
That's a fantastic question. So my my own work on this did not go into that, but there are organizations, oftentimes more by state is what I found, especially because when you look at the United States, the Medicaid gap really affects certain states more than others. And so I remember speaking to someone who was based in, I want to say in Arkansas, and so her organization, I won't remember the name right now, but her organization worked on getting medical resources for people who lived in that area, who were falling into that gap in terms of Medicaid had not been expanded. And so she knew patients who were hoarding their medication essentially for everything from kidney disease to diabetes, just hoping, okay, if I can save some of my insulin, make it stretch longer. So yeah, I would definitely look at the state level for that. There is a wonderful organization for Chagas disease called La Socha. It's based in the Washington, D.C. area. And they go out into the community to do screening and connect patients with providers and with care. In Los Angeles, I write about this clinic at an LA County hospital called Olive View, that they were very much focused on breaking down that epi divide by going into the community to screen, same thing, and getting patients in. So I would say that, yes, there are a lot of organizations, usually more at the state level. And also, while I'm here, a big shout out to the physicians and nurses and social workers, especially at county hospitals. That's where you're seeing a lot of efforts, even though it might not be formally organized. They're working behind the scenes. So I know that the doctors in Harris County, in that's the Houston area, they worked really hard to get defibrillators covered with Medicaid dollars in their arena, in their state, I guess it was. And so that was advocacy from the doctors and the nurses' side.
Wow. Yeah, I guess we're very lucky to have people like that in that system trying to make sure that people are getting what they need.
There are a
Um,
lot of unsung heroes out there. Yeah.
yeah, well, I mean, that's half of our health industry, right? I mean,
Yes.
uh, so I want to step back to the introduction to the book. And you talk about growing up, your family whispered about Chagas, but they were never really confronted the disease. They may have had a lot of misinformation about it. So I'm wondering, what was it like to uncover the truth of the kissing bug and Chagas disease after your aunt's death? And what made you actually decide to write a whole book about what you discovered about this disease?
Yeah, I wrote the book because when I started learning more, I thought surely there's already a book out there, for a general reader,
Right,
not something that required me to already have a medical degree in hand or
right.
PhD in biology of some kind. Um, and I saw that there wasn't a book like this. So there wasn't a book for basically families who were impacted by Chagas. Um, and so I really, heeded Toni Morrison's famous lines to, if there's a book that you need to read, then you go and write it. So initially I thought I was writing an article, and for the first time, I met another family who had been impacted by Chagas disease. This was a woman in Virginia who was pregnant, and she knew about the disease from her home country. She was an immigrant here. And so she went to her obstetrician to ask to be screened. Like, she knew about prenatal screening from her own country, and found that the doctor didn't initially didn't know what she was talking about, and she thought, oh, it must be my English, it's my second language. So she printed out paperwork, she went online and printed information
Oh my
about Chagas
goodness.
disease, brought it to the doctor. And unfortunately, that doctor, without knowing very much, quickly decided that she was worrying too much, a very kind of classic reaction that too many women get in the healthcare system. Unfortunately,
Yeah.
you're exhausting yourself with worry. So when I interviewed her, and she was very fortunate, she was not infected herself. Her child did not get infected, but her mother, in her case, her mother has Chagas disease. And
Oh,
so I wrote the story, and I realized as I was learning more that there was just it seemed like, okay, maybe it's going to be 2 articles, or maybe a long essay or something like that. But then I learned about these advocates, out in Los Angeles, this Dr. Sheba May Mandy, who's retired now, but was working for years to go into the community to screen people. I had to write about her work, and then as I looked into the history of Chagas disease and how it was discovered in
hmm.
Brazil in 1909, that was an entire story. And so it just kept growing and growing. And I still remember the first time I interviewed a biologist who was talking to me about the disease from the perspective of the insect. And I thought, oh my goodness, I had grown up with this disease, always thinking about what it was like for patients, but never on the science side of it. And then, of course, I found myself in a room in Colombia in the middle of a
Yeah.
major city, with an insect colony, and I thought, okay, so it began to so clearly want to be a book. So yeah, that's how it came together. But really, I was thinking about families who didn't have a book like this and needed one.
So it sounds like it started with kind of personal stories, but as you kind of learned more about it, as you realized the scale of Chagas in the US, how did your approach to your writing evolve? Like, how did the story itself have to evolve to kind of encompass that wider lens?
It's such a good question. I really expected to initially stay pretty close to those narratives of patients. I was meeting patients who were going through experiences similar to what I had seen with my auntie, and then other experiences that were very, very different. So you're right. Initially, I thought it's going to be personal narrative. So I don't have a science degree. I never expected I'm a big fan of Science Friday, but I never expected to be on Science Friday. I did not see myself that way. And so, yeah, um, I really had to get into the science. I needed to see what the parasite looked like. I didn't have to go to Latin America. I went to Iowa to see what the parasite Trypanosoma cruzi that leads to this disease looks like. And then ended up really structuring the book to follow the journey that I took, which is I knew about the disease as a child, growing up as a young person into my 20s and 30s and so forth. But then, yes, then it was going out and actually for the first time seeing this insect that had been um, such a kind of looming image in my childhood.
Mm-hmm.
And they do look as scary as I felt as a child. Some of them are pretty intimidating, the larger insects. There's many species, as you know, if you read the book. But yeah, I think taking it into that second half of the second part, it's loosely 3 parts, the book, but that second half really going into the generosity of scientists who were willing to sit down for long interviews and go through, even though I kind of took myself to, parasitology boot camp.
Yeah.
I read a lot of articles. I created glossaries for myself. I taught myself as much as I could, but I really relied on the generosity of scientists to say, we're never going to eradicate this it's a zoonotic disease. We don't eradicate zoonotic diseases. We can't,
Right.
there are more than 100 species of
Right.
triotomine insects that could carry this parasite. So even if we get, as this professor said to me, even if we fully got eliminated 5 of these, there's a whole bunch sitting on the bench like baseball
Right.
players, ready
Yeah.
to come out and take their place. So that was exceptionally eye-opening.
Yeah. Oh, wow. Um, so I'm just kind of curious, because you have this personal relationship with the disease with your aunt. Were there moments that were challenging to like navigate that kind of perspective as a journalist versus a family member who has experienced this, in real life?
This was definitely my most difficult book to write. When I wrote my previous book, which is a memoir, Cup of Water Under My Bed, a lot of people asked me, "Oh, is it hard to write a memoir after working as a journalist?" And the answer was no, because I just kept them very separate. They were like
Mm.
2 friends, I always say it's like your high school friends and your college friends. That's how I tell my students. And they don't necessarily meet. It was like that. I did my memoir over here, and my journalism was very separate. But with this book, it was the first time that I was bringing my 2 friend groups together, my college friends that were meeting my high school friends, like that.
Right.
And so it was very difficult to weave them together, even at the level of the interview, because when I began, I would not tell people that I had a personal connection to the disease, because as a journalist, you don't do that.
Right. Right.
That's how I was, at least that's how I was trained. You don't reveal your personal connection if there is one to a story. After some time, it actually felt unethical to me to not tell them that I had a personal experience to it. But a lot of unexpected questions then came up when I shared that I had a family relative who had Chagas disease, because pretty much one of the first questions that they had for me, patients specifically, was, how is your auntie? ¿Cómo está tu tía? And so it was really hard at that point to tell people who were worried about their own lives, their own health, that my auntie had died from this disease. And then I found myself in such a strange role of, saying, but she lived for many years. She had a very good life, a
Right.
very
Right.
abundant, big life, because all of that was true. It was chronic. She didn't die, she lived for many decades, and got to be a school teacher, and she got married to a man that she loved. And, so then I felt like I was almost, like a therapist or a counselor
Oh,
trying to
no.
say like it can be okay. So it was very, very strange. And on the flip side, it was also I had very odd encounters with professionals because they were, scientists and doctors were always very professional with me. And then somewhere towards the end of the interview, I remember they would ask. I remember one of them saying, "So I see your last name is Hernandez. Can I ask, if you have a personal
Oh
interest
my gosh.
in the disease?" And so usually at some point in the conversation, I would disclose, yes, I have a relative, and that's how I first came to know about the disease. But and they appreciated knowing that, to be honest, because so many doctors and other medical professionals who work on this, they're used to being neglected, right? They're used to no one caring about Chagas disease. And so they would be like, wow, why are you interested all of a sudden? So I think for them, it was a little bit like, oh, okay, now it makes sense.
Wow. We have some questions coming in, and folks, make sure that you're putting your questions into the chat so we can ask Daisy. You spoke of the insects, so let's take this one from Mr. Earl Byron. Years ago in a SoCal entomology course, I learned that, I'm going to mispronounce this, triatoma bugs were easily or primarily found in pack rat nests. Are pack rats a risk factor? What are the risk factors like in the environment for kissing bug?
Yeah, so in the United States, we do these insects are native to all of the Americas. To North America and South America. In the U.S., we mostly have them throughout the South, the Southwest, and all of California. They have a lot of nicknames, which I wrote about in the book. So in Latin America, in Spanish, there are lots of nicknames. Vinchuca, the big chinche, as opposed to little chinches, which are bed bugs. Barbers in Portuguese and Brazil, pito, and so many names. And actually in the Southwest, they would often be called bloodsuckers, which reflects what they do, which is that once they get to a mammal, we are also mammals, so including us, but also, yes, pack rats, all sorts of rats, all sorts of other mammals as well. They take a blood meal, right? And that's how they keep themselves alive on us. And so, yes, they're found throughout California, including in the LA area. And they are nocturnal creatures. So they really like to come out at night. They're usually hiding out during the day. So anything that would be a nest would be very attractive to them. So yes, nests for rats, prairie dogs, possums. They love possums, but yes, they have been known to, like, these insects. They can take a blood meal, and if you look at what Charles Darwin discovered, because he collected these insects in South America, he found that one insect could live for like 3 months with just one blood meal. So they can go quite a long time without feeding. And so yes, so within the US, what I say to people is, well, you basically, if you're an outdoors person, and you're in the South or Southwest or along California lines, you basically want to do what the Defense Department does in Texas. That's where they keep and train their dogs that they use in the military, and also for TSA and airports and stuff, which is, you really want to fumigate, and you want to, if you keep your dog outside, your dog, a dog in Arizona or Texas or Los Angeles has a good chance to come in contact with these insects. So you want to fumigate, you want to cover yourself in bug spray. I write in the book about being in Texas and going out bug hunting. And this young man who worked for the university there told me about that, if he really wanted to catch some kissing bugs, he would just go out camping, and they would get permission to go on these ranches. It's just
right.
you and nobody else. And he would just sit there and just wait for the kissing bugs to come out for him, and then he'd snap them up. I don't recommend doing that, but if you're going to go camping on a ranch in Texas, spray yourself. And that's basically what the Defense Department does for their soldiers, when their recruits, when they send them out as well. But it's not too much. We don't have huge rates of transmission of of Chagas disease in the U.S. We don't know exactly why. It might be the way that the insects function here, which is different than they do in other regions. But yeah.
It's interesting. In the group, there's been a lot of kind of talk of thinking about other insects that are vectors for disease, like those of us in New England are very familiar with ticks and Lyme disease. And so there's been a lot of kind of discussion about like these diseases that were hidden. And even in the case of Lyme, how many people were kind of told, oh, you're imagining it, it's fine. And now we're discovering that not only does it exist, it can be chronic. And so I think as people think about this, it's interesting the diseases that are hidden, especially like this, because there's so much discussion about Lyme and almost none about Chagas. So, and I think you bring that to light a lot. We've got a question here that we had in the group too. Carolyn, you said Chagas is not included in prenatal screening tests. Do you know why they aren't? Are they too expensive, or is there some other reason?
I actually don't have a formal response from health authorities about why it's not included. I would say that I suspect that it's simply there hasn't been advocacy for it. There hasn't been the political will being, people, you have to push to get that. And for so long, this is beginning to change, but for so long, obstetricians didn't even know about Chagas disease. So that is beginning to change. I do think that I haven't found a recent survey of obstetricians and gynecologists, but just through word of mouth, it seems like there's a lot more awareness. I recently, a couple of years ago, actually, now I got to speak to somebody who was just coming out of medical school, had been trained as a gynecologist, and she actually did know about Chagas disease. Not too much, but she knew it was like, it's a thing. It's a disease. So there's more awareness now. But I would say there hasn't been advocacy for it, and there hasn't been the political push to get it to happen. It is rather and just remember that prenatal screening guidelines happen at the state level. So not every state has there's national guidelines that influence that, but every state also gets to decide on its prenatal screening.
Yeah, I remember in the book you talked about like this kind of list of diseases that are screened for, and then Chagas, which arguably is more common, is not screened for. And yeah, those decisions seem to be not exactly transparent.
Exactly.
And then I was also shocked, and I'm forgetting what percentage, but it was a shockingly high percentage of obstetricians and gynecologists that were asked about Chagas disease, and they were not able to answer any of the questions correctly about how the disease is transmitted, what the symptoms are. So yeah, there seems to be a real uphill battle about just people understanding the disease itself and what to look for. This is a really interesting question from Linda, and I don't know, are there effects of global warming on the spread of Chagas?
I am fascinated by this question as well. So I do address it in the book. Triatomine insects are very picky about the weather. They don't like it too hot. They don't like it too cold. We don't find them in the Caribbean, for example. So right now, as far as I know, right now, it's mostly doing estimates, when it's going to continue to get hotter. So the scientists are expecting that these insects will be moving further north as parts of the South get hotter. And you are finding, even within the US, there have been reports of these insects in places, actually Illinois, where I am, which would, considering what the weather is outside right now, is pretty shocking. We're not overrun by these bugs in any way, but just even the fact that they would be here at all in tiny numbers is surprising and is a little bit of a change. So they are expecting that some parts of the world, of the Americas, will become too hot for the insects, and some spots where you would never have seen them will become more amenable. But it hasn't quite happened yet, so no need to worry right now in that sense.
We have another question from Suzanne. She's curious, when you were talking to Carlos's wife in the hospital, which is in the book, What did you tell them you were? Did you say you were a journalist, or did you tell them you were a translator, a friend? Like, how did you negotiate that? Because it's pretty sensitive. As you mentioned, your aunt didn't really want to talk about the disease. So kind of curious what that was like.
So that was an unusual situation. So, usually, as a journalist, when you go into a hospital setting, you would contact media relations for the hospital and ask for permission to be there, and then they would basically attach someone from the media relations office to you for the entire day, or however long you're in the hospital. And in the case with Carlos, I bypassed that. I cannot tell you how painful of a decision that was for me to do that.
Oh,
But
wow.
I did not want a media relations person attached to me all day. And I knew that it would influence how they were treated. It would maybe have been positive, but I felt like I did not I did not want this person there the whole day and influencing how the exchanges occurred. So I didn't have to tell anything. No one asked me. No one asked me, and I think mostly they didn't ask because I looked similar to Carlos, and
Mm.
his sister-in-law was there. I think we all looked like we were related or could be related. I think if I was blonde and blue-eyed or very fair-skinned, I might have had a whole different experience. So I just walked into the hospital with them, like, "Hey, we're here for Carlos. He has an appointment at 12," or whatever. He had a whole day of appointments, so it was an entire day at the hospital. So, however, I never expected that they would think I was his wife. I don't even know why I didn't think it through that, oh, they're probably going to think I'm a family member because in my community, on the Latino side and working class Latino communities, you have friends
Yeah.
go with you to the hospital. Like it's not just your family members who are with you. So in my own I just got to see a lot of my own cultural assumptions. I just assumed, oh, they'll assume I assumed they would assume that I was a friend. So it was very startling, but I basically just danced the dance all day. So when they assumed that I was his wife, we just joked about it, but I didn't make a correction. I didn't say I'm a friend. So I didn't lie, but I also wasn't forthcoming with information.
That's fair. Um, so I'm kind of curious now that you have written this book and you talk about Chagas, but also other neglected diseases. For example, you talk about HIV, AIDS. Um, what do you hope readers take away from this book about how we decide which diseases get attention, which communities get attention, and who gets resources to deal with these neglected diseases?
Yeah, I'm definitely hopeful that people will be thinking that, about the fact that there is this epi divide and that and sort of ask themselves, well, what role is that playing when something happens in my community or nationally or globally? What role is that playing? And you really saw that with COVID. That was
Mm.
actually pretty amazing when COVID first hit and we were seeing these disproportionate impacts on the Latinx community, on the African American community. Initially, you had people saying, oh, it's because they have bad health and comorbidities and so forth. And then it was amazing to see all these mostly predominantly Black scholars and journalists come forward and say, no, these are actually our essential workers. There's a long history of inequities in the healthcare system that would lead to comorbidity. It's not just like people are walking around saying, I don't want to take care of my health.
Right.
There's many reasons why communities are in the situation that they're in right now. And so I hope that we will never see anything remotely like COVID-19 ever again. But there are other things, we're seeing these measles outbreaks. We're seeing
Mm.
other things that happen. We will see another virus of some kind, hopefully just not at the scale of COVID. But when dengue comes back, or
Right.
anything like that, I hope that readers will think through, okay, what are the bigger picture? What's the bigger picture here? What are the structural forces that are at play that mean, I don't have to worry about this and someone else does?
Yeah. Um, Interesting question from Sandra. Have changes at the CDC affected the tracking of Chagas? Because we know there are a lot of changes going on at the CDC right now.
My understanding with Chagas, both with the CDC and the NIH, is that as soon as COVID hit, any little bit that was devoted to Chagas got put on the back burner, very legitimately COVID. Um, and I don't know that it's actually come back, since then. What I can say, not so much with the CDC, but with NIH, there were some efforts there to help patients or work with patients who had been diagnosed with Chagas. And unfortunately, that had to stop because NIH facilities no longer are safe because of DHS sending ICE and Border Patrol into hospital settings. And so those aren't just, they're not safe places anymore.
That's yeah, that says something. Here's another question from Jennifer. After being so immersed in this science story, do you see yourself writing more science stories or books? Are there other, I don't know, neglected diseases, stories, or communities that you want to write about?
Yeah, there was a moment while I was working on this book that I thought, oh, if I could do it all over again, I think I would be a science journalist. It was so amazing to discover all of these different worlds. And I just tapped into a very tiny part of it. I have thought about, it's not the next project, but I have thought about working on a book that looks at many more neglected diseases. And that actually came up at one point while I was working on this, just simply because of what I write about in the book, which is it was such a shock to me to realize that both for public health in the US and globally, we don't actually have a policy of eradication. Sometimes because biologically we can't, such as with the zoonotic disease, but also because so oftentimes, once the disease is contained to a vulnerable community, the rest of us are okay with that, essentially, right? It kind of goes to the back burner, and whatever is more urgent for those of us who have resources comes to the front burner. And so I became really fascinated. There are so many other diseases that I could write about that get neglected specifically because they're very contained to areas of the global South.
Gotcha.
So if you want to read that book, put it in the chat that you want to read it so I can work on it in the future.
Let's let Daisy know that we want to learn more about these topics. I mean, I guess we don't want these topics to exist, but they do. So I think that it's important to let people know
Mhm.
that not every and again, I think we all inherently know not everybody is getting the same access to healthcare, but sometimes you need to actually put that in front of people and get them thinking about it. Which brings me to a question I had for you, because I'm very excited about your next book. But in The Kissing Bug, you explored Chagas and medical inequity and your own family narratives. And then your book, Citizenship, explores immigration and belonging. And I'm kind of wondering, are there ways that these projects are connected for you, or is there kind of a larger picture that you want to explore? I'm
Yeah,
looking for the
actually,
thread.
this new book, Citizenship, began with a chapter that I initially wrote for The Kissing Bug and removed from this book, because I realized, and so actually the chapter is this. I'm having a conversation with Janet, whose baby was born with Chagas disease, who I write about in The Kissing Bug. I was having a conversation with her about her own health insurance coverage, and was asking her. I didn't expect that she had health insurance coverage, but I was asking her what she was doing in terms of being able to see a doctor and what coverage she did have. And I did just plainly ask, do you have health insurance? And her answer was, no, I don't have the 5 years. I was like, the 5 years? And we kind of went in circles as I was realizing I knew this, but I had not made the connection, which is that if you're a green card holder, you have to wait 5 years before you can access Medicaid.
Oh,
And that depends on the state in which you live. And it also depends on whether someone has told you, actually, you live in a state that does use its own state dollars for Medicaid for people who are
oh,
green card holders. And in her case, she was in a good place. She just didn't have that information. But it made me think about, well, how did we take care of people when they got sick before Medicaid? And I don't
yeah.
mean like before the 1960s. I mean, like, how about at the start of the country? Like in
Oh, wow.
1776, what did we do? So I went down that rabbit hole of, what, because I was really, at what point, how do we come to the point that we basically make citizenship a requirement for seeing a doctor? Because that's where we
Right.
are now in the US. And so I wanted to know, what was it like before. So you can read about that in my new book called Citizenship: Notes on an American Myth, about some of that history, also about the story of my own family as well in terms of citizenship and what that meant for us.
Wow. You saying that is interesting. So I'm a second generation Irish American. My mom was from an immigrant family, and she lost a brother just to pneumonia because they couldn't afford to go to a doctor. And just thinking that that's a reality in this country, and still, I mean, that was the 50s or 60s. I'm like, that shouldn't be happening, but it's still happening, and that is, I think, something that is shocking, but also, I think, too familiar to too many people. Um, you know, Mr. Earl Byron is one step ahead of me here. So, is there a need for a good general book on the surprising prevalence of zoonotic diseases to humans and the climate change that affects them? So, continuing that, what might be your next science book?
That is a fantastic question. I mean, yes, and also, I mean, you know, David Quammen has, I think I'm mispronouncing his last name, but his books are incredible, and I won't remember the title of one in particular that I'm thinking of, but he's done amazing work on disease. I was also going to say, well, so yes, I think we can have more zoonotic disease books on zoonotic. There are some amazing books out there. Obviously, David Quammen and Sonia Shah's book on malaria fever
Oh,
is excellent, and just really an incredible history of malaria. And she talks in, I'm trying to remember if it's, I've read a couple of her books. I'm trying to think if it's that book, or it actually might be her book on where she used, the book that just came out right before COVID-19. Her again, sorry, I won't remember the titles, but she's basically following cholera, and like
oh
everything she
yes.
said about cholera, we just saw happen with COVID. It was incredible. So different, different, but yeah, the malaria book, fever, is amazing. But yes, I think we need more books on zoonotic diseases, because partly, as I think everyone is thinking about, is just, and how, what I learned from working on this book, just the incredible integration that we have with wildlife. And I say that as a 100% city girl. I am a city girl, 100%. And so it really opened my eyes, especially for readers like me who don't go hanging out. I don't go camping. So it was so eye-opening just to see how just, woven in actually our lives are with the natural world is incredible.
And friends, book club friends, we will track down those books and post them in the group for you. So, because I know you're always looking for your next read. So we're just about at the end of our time, and I wanted to just take a moment, because the next question that everybody always has is, all right, you've convinced me. I need to learn more about this. I want to dig deeper. What are some ways that people can continue their learning journey around Chagas, around medical inequity, and some of the big topics that you bring up in the book?
I always point readers to Linda Villarosa's incredible book, Under the Skin. That should be required reading for everyone in the United States. And that is specifically around racial inequities in healthcare. It is a stunning book. I tell people, read it slowly and not before bed, because you will have disturbing dreams. And then be ready to take action after you read that book, because I had just as a reader, not even as a journalist or whatever, just I learned so much. About racism in the medical field in the US. That is an incredible book. At a much larger level, I hope that readers will, I feel like if you read this book, Fever by Sonia Shah and Under the Skin by Linda Villarosa. You now have a trilogy. You have 3 books that tell you, at the very least, that if you are able to vote, that you should be very committed to candidates at the local level and the national level who support, policies of expanding Medicaid, of making healthcare available to all in the United States, and also looking at your own life, seeing what moments in your own life you're able to use to stand up for healthcare. So in my own case, my employer just recently switched us to United Healthcare. And so I got on email and I emailed our administrators to let them know how much this was going to be affecting me. And I'm not someone who has children depending on me for healthcare, but I spoke up for my colleagues who have children who have specific medical needs, who are now going to be going through such a rough transition and so much uncertainty. And families, again, we don't always need to be speaking up for ourselves. It's great if that's the situation, but it might be, our coworker or our neighbor, our friend who is going to be struggling in this case with United Healthcare against the algorithm, right? Because even, there's incredible I didn't have to do this journalism work. It's already been done, just showing the incredible reliance, United Healthcare much more so than others. They all use the algorithms to determine whether your claim should be accepted or not, denied or not. So when it comes to healthcare, there's so much that we can do at a little level. I always remind people, every time you go and you share that article on social media, that's a form of doing activism and of standing up. Or even better, what I say is better right now than even posting it to social media is texting it to your friends, to your coworkers, direct messaging, because we're so inundated. And let's be real, some of us just are going on YouTube to watch the funny dog videos, right? We're stressed out. So I know for myself, when I get an email from a friend that says, hey, did you read this story? I pay more attention than when I see it on my feed, even though it's my friends on my feed. So there's so much kind of, activism that we can do right at home. And then there's more activism when we get out on the street, of course.
And friends, if you want to share, of course, this video, but also Science Friday interviewed Daisy on our show. And that's another wonderful interview where you talk about so many of these issues. So that's a great one to share if you want to get people curious and discussing these issues. We are kind of coming to the end of our time together. So where can people find out more about your work, more about your books? How can they follow you? If they want to be a Daisy fan, how can they do that?
Oh, that's a beautiful question. I love that. If they want to be a Daisy fan, how can they do that? I am generally living on Instagram and Facebook, so you can find me there. I think on Instagram, I am Daisy Her is my handle. I post on there and on Facebook. I'm not a TikToker. But my website, I usually post. I'm going to be on book tour starting in a few weeks, actually. Wow. So I will be in some big places like, New York, DC, the San Francisco area, down in Miami where I have family. Here in Chicago, of course, is my book launch. So yeah, you can definitely catch up with me there. If anybody's in Tucson, I'll be at the book festival. I'll be at the book festival in San Antonio in April. So I'll be making the rounds and definitely posting on social media and also on my website as well.
Oh, that's great. And I see Taylor, our amazing moderator, has dropped your book tour website in the chat. So folks, you can bookmark that and make sure that you know where to find all of Daisy's next appearances. Thank you so much for being here. This has been a really interesting conversation. And I think, I don't know, this book gave me so much to think about. And I really appreciate not just the science, which I know may have been a little new for you, but I do appreciate the personal stories, because I think that makes it something that feels so much more immediate and so much more personal, because I think any mother can see themselves in the mothers that you talk to. any of us can see ourselves in those stories. And also hearing about your aunt, I think we all have that beloved but complicated person in our lives that we can really relate to the stories that you share. So thank you so much for being here. Thank you for writing this amazing book. I cannot wait to read the next one. We're going to have you back to talk about that too,
Thank
as
you.
you're doing your tour. Thank you, everybody, for joining us. If you want to continue this conversation, join us over in our community group. Keep asking questions there. We are going to sign off for today. And I just have to share this one. Oh, where is it? The personal stories make the science come alive. It's a beautifully written book. And thank you so much for your wonderful book.
Thank you.
I think
Thank you so much. I really
I don't know
appreciate
of a
that.
better place to end this. That's the sentiment. So thank you,
Thank you.
Daisy. Thank you, everybody, for joining us. Our next book coming in March will be Life on a Little Known Planet with Elizabeth Colbert. I always mispronounce her last name and I feel bad about it. But that's all about climate change, a series of essays. So I'm curious to see how these two might actually touch on some topics together. All right, everyone. Thank you. Have a wonderful afternoon. And remember, at 2:00 in just a couple of minutes, you can listen to Science Friday. We have some very important stories today about science in America right now. So take care, everyone. Good night or good afternoon or good morning. And